Hello, nice to meet you in web online lecture, and I'd like to give you some little bit of tips today in using nickel titanium rotary files. So I'd like to start my lecture with NiTi rotary files instrumentation technique and clinical tips. You probably already use nickel titanium rotary files, so I'm not going to go into the details of what NiTi file is and how they are made of or what is their characteristics. But I'd like to give you some tips in real clinical situation, so that will help you in real clinical practice. Okay, I'm going to start with my lecture here right now. So as you already know, the essentials of root canal therapies try to remove the source of infection from inside of the root canal. It may be infection or the rest of the remnants of the infected tissue. So for this purpose, we use files inside the root canal. And it has been, the hand file has been used for decades or centuries to get rid of the infection and to get this purpose. And there is certain conventional rules not to skip sizes, and we have to recalculation until we get the smooth inside shape, and to get rid of effectively the inside the remnants, we have to do the step back. But all these kind of steps are really handful and bothersome. So if you are really become a good endodontist or a better endodontist, you have to prepare like this. But I'd like to give you some more better idea of compact your everyday practice to efficiently, and you have reduced your cost. So these are all came from the hand file, but hand file has a limitation. Like you already know, there is a lot of errors, Trojanic errors like transportation or latch or gyps. So it happens because of you already know the tooth factor like curved canal or nature of the file. File has, the original shape of restore to its shape. So when you use a file like this curved canal, you're gonna have problem like this. When you extract a tooth, there is a severe curvature, so that's really dangerous when you try to do the root canal. So after NiTi file has introduced, these all problem start to solve, and the rules have changed by using this nickel titanium file that you already know. So that makes you follow the curvature easily, and you can have your time saved, and also the operator's fatigues have been reduced, and now you have better shape of the root canal treatment. So I'm going to give you an idea that how can you set up your root canal treatment with this nickel titanium file. You probably combine with your hand file with your nickel titanium file. But what kind of file do you use? We have to take a look at the evolution of the nickel titanium file. It is started from the 1993, and I also started to use nickel titanium file from the year of 1999. It was almost 20 years ago, and it evolved to 4th generation today, up to wave 1 gold. You already use, you have told us, and then these days it is introduced a new type of file, true anatomy. So if I have time, I'm going to introduce this type of file to you too. And the important thing is, which nickel titanium file do you use? You probably have variety of files that you can use in your practice, and you can combine or you can stick to one file in your practice. But I'd like to give you some idea why I use this certain type of file and what is the advantage of the file that I use nowadays. So I still use first generation like profile. It is really steady and give you a certain control and confidency. So I still use, but also you need like a efficiency and a faster preparation. So that's why you use third generation or even fourth generation file. So I did a survey in 10 years ago already, like certain questionnaire, so that all the doctors who use nickel titanium file can answer for the questionnaire survey. Among them, as you have interested in, what is your primary nickel titanium file that you use in your everyday practice, and what is your preparation technique, or do you reuse how many times because of the cost of the file? It is same happen to you in our country as you have concerned about the cost of the file, and also we have to consider about the fracture frequency. So we try to avoid the fracture frequency. So how can you avoid the fracture of the file? So before I start to introduce the file that I use, I'm going to show you our friends or our graduate students. So our professors also use nickel titanium file, and they have variety of file like a BLX file. It is similar to Endo, I think, and then ProTaper Next file. That is some advantages and disadvantages. So you may interested in, or other type of file like a Wave 1 Gold file. And our graduate student also use variety of file like this. You may not even know the name or brand name, but they kind of stick to one type of file, or they combine certain combination of the file. So according to the survey, I figured it out. It was also 10 years ago, but they usually primarily use profile and ProTaper file that is similar to me or other doctors in our country or in your country, I think. And also they use TF file that you use, or K3 file. And it is similar to the survey in Journal of Endodontics in 2009 in United States, which they answer to, they use the profile and ProTaper most of the time. But I tried to show you that the advantages of profile is they are really steady and slow, but they are not aggressive. So like you see in this movie clip, it works really fast according to the 300 RPM, but they don't cut that much. But it works much faster than your hand instrumentation. Like you do the hand instrumentation, you are working with the watch winding motion with your hand file, but it's really faster, but it works efficiently to gradually reach to the apical area of the root canal, and that remove the tissue or infection. But the disadvantage is it takes too much, and once your file is inside the root canal too long, then you're going to have much more chance to separate the file. So that's advantage of this, but advantage of profile. But I still use profile in certain situation because, like I told you, it gives you a certain confidence. And when you move on to the little bit aggressive file like a ProTaper file or ProTaper Next file, it is really efficient. like you can see here, ProTaper Next file, it moves like a snake move, like go in and out. And once you done with the instrumentation, you're gonna have much faster and efficient shape of the root canal. But at the same time, it has a disadvantage, like separated inside the root canal, especially when there is a severe curvature at the apical area. So you should be very careful, and you should be you're gonna get the stress when you use this type of file. But once again, as you can see here, it shows a really good, efficient shape of the file. So that's gonna be our primary nickel titanium file, but it was also, like I told you, 10 years ago. And at that time, in my survey, what is your preparation technique? And they answered that they have variety of preparation technique, like a combination or crown down or shaping up. So you cannot really, say one technique that you use, but at the same time you have a problem with how many times you reuse, right? So I asked through the survey that there is several times they reuse because of the cost of the file. We have to sterilize and we have to use, but at the same time it has a disadvantages that you're gonna have fracture. So certain doctors fracture once a week or once a month, or other doctors says that never or rarely fracture file. But at any time you're going to have a fracture file, that will give you stress. Why is it separate? There's a theory that they have torsional failure or fractural failure that you doctors already study through the articles. And simple explanation of the separation is this file, nickel titanium file, is rotated with a really fast speed, like a 300 RPM, and then once you have a grip of the tip of the file at a certain area with a tight canal or curved canal, and then the corner portion is keep rotating at 300 RPM while it is stopped at the apical tip area. It's locked, then that we call taper lock, and it's gonna have separation at the tip of the file. That is really dangerous time, so you have to avoid that. So I'm going to give you another clinical tips to avoid that separation of the file. That's really helpful. What kind of your file, nickel titanium file you use. But anyway, it happens, so you have to be very careful not to aggressively use at the tip of the root, like this severe curvature or S type of curvature. But it happens. As you can see here, it's separated at the tip of the root at the really severely curved. But I didn't do that. My graduate student did that, and then I blamed that, and then I started to treat this patient with another tooth, and then I separated with long and deep portion with another file. So I cannot blame separation. I should be careful and avoid that. So is that going to have a problem whenever you have separation of the file every time? No. They say that according to the article, you probably studied that, the healing rate is 91%. So try to go to the deep after you sterilize, clean the root canal, and then try to go deep little by little. That can avoid the infection or failure. So this case, after the follow-up, we have figured out that there is no problem with this tooth. So I did a crown on top of the tooth, and it can survive. So the reason of the survive is the preparation of the tip area is very last end of the preparation procedure. So try to remove the infection from the beginning by like coronal flaring or crown down, and then irrigate, and then use lubricant that will help you to avoid the failure even though you have separated. And once you have separated file, you're gonna extract it right away or ignore that tooth? No, you have to follow up. That's the rule. So once you have separated, you have to check regularly the patient, the symptom, whether they have problem with the separated file. So I followed up 6 months after the crown, and then patient came after 1 year, 2 year follow up. There was no problem, and then even 7 years. So apical area is still intact and sound and normal. So the follow-up is another rule to check the sequel of the separated file. And then most of the time, like I told you, you're gonna have no problem, but you should be very careful not to separate the file inside the root canal. So how can you prevent that kind of accident? Do you really count that file? It's helpful, but sometimes it's confusing. How many files you use, and which file do you use in severe canal, and which file you use just straight canal? That you cannot really differentiate. So I use one single file, like in Chinese character, and how many times you use. And then if it is based on molar case with a severe curvature, then I throw it away. So it kind of prevent by yourself. You make it rule so that you can prevent the separation of the file. And you also have to check the file just before you use. And especially in severe curvature, you have to use just once or twice. That's it. So in severe curvature, like abrupt curvature, or S-shape, or calcified canal, or merging canal. Sometimes merging canal gives you certain feeling of it's not safe. So you should avoid that kind of canal shape. Severe curvature is not seen in by X-ray. So X-ray shows that it's straight in the distal canal with the molar tooth, but sometimes with the curve with the canal in the distal lingual canal, it is really away from the distal buccal canal. Once you get an X-ray in this angle, it shows like a little bit of curvature, but you took an X-ray with another shift angle, you're going to have a severe curvature like this. So you should be very careful not to force or not to rush to this kind of curve. So as you can see here, this is the tooth of the medical doctor. He has to extract his tooth, and then before the extraction, I took an X-ray, like a straight root. But once you take a look at the lingual side, it has curvature hide behind. So it happens frequently in Asian people. So probably your country also have this kind of tooth at the lower first molar with separated distal canal. So distal lingual, we can figure it out. This is with a little bit severe curvature, it's hiding. So in this type of case, how can you reduce taper lock phenomenon?